Democrat Party in 1950. Because of this insistence on the federalizing of health care, the Democrat Party lost huge in the 1950 mid-cycle election, right? And they learned from that, though. They didn't go to sleep on that switch. They decided to change their strategy to incrementalism. They decided, we're no longer going to talk about the federalizing of health care. We're just going to talk about, well, the care of the disabled. The Disability Act is where it really they really gained traction in 1956. And they spoke of it in closed chamber. They spoke of it as the necessary prelude to universal health care. So in 1956, the Disability Act established the process by which taxes are collected at the federal level and spent on health care. And that was the nose of the camel inside the tent. And that got the AFL-CIO on board the following year. So now you've got major union involvement. And that incremental approach continued using the propaganda that had been developed in the 30s and 40s about how to speak about the issue. Now they're out in the open about it. It's the late 50s and going into the 60s. And the idea is that they have to manage, as a party, they have to manage the political cost of speaking about healthcare. That's really the issue. You speak about healthcare, it extracts a political cost. Now they got to manage political cost by framing the argument, using the right verbiage. And the whole thing was based on a sympathetic appeal. This is going to be the answer to the dependency of the aged, right? And what they decided was to shift dependency of the aged away from family and away from charity to the state. And they basically appealed to the middle-class working families. You know, we'll take care of your mother when she is old and infirm. You know, your dad died and there's no one to take care of mom. So we're going to create the system that's going to take care of mom, and it won't be a burden to you. Right? So they used this sympathetic appeal for the care of the elderly, and it appealed to the middle class because, wow, the middle class is going, wow, you mean they're going to take care of my mom, and I can take that money and she won't have to move into our house and drive my wife nuts and whatever, right? So it was not an appeal to virtue. This was an appeal to vice, you know, of somebody else's money is now going to get spent to take care of mom. And so 60% of the working middle class supported it. They found a way to manage the political cost of proposing federal health care. And that's when it really took off. And it happens that one of the champions of this, who had been in Congress for years, senior congressman from Texas, just happened to step into the White House after some unfortunate events in Texas. And it was under Lyndon Johnson that the Medicare Act came into being. The rationale for the passage of that thing was that we were going to be caring for responsible older people. This isn't care for, you know, some bum who's asleep at the Greyhound station. This is your mom, that precious, precious woman, right? Responsible older people. And we're going to save them from catastrophic financial ruin. However, the bill itself never had any provision in it for catastrophic care. The champions of the bill were actually questioned on the floor about this bill that ostensibly has catastrophic coverage that didn't actually contain catastrophic coverage. And they sort of waved their hands and excused themselves, and on it went. But the important thing is we got to get this bill passed. We got to get it passed in a hurry, and they got it passed, right? This was a deliberate omission and a misrepresentation.
Somebody read it.
It was, yeah.
They finally read a bill.
Yeah, imagine that. Yeah, somebody actually read it and said, hey, wait a minute. The other thing is that they misrepresented the poverty of the elderly. All right. The argument they made was that your income stream when you're 65 is far, far smaller than your income stream when you're 25. And when you're 65, you're more likely to have medical issues. Therefore, you can be impoverished by a medical issue coming up when you're 65. What they misrepresented was the wealth of the elderly. They based it on strictly on income stream. Well, it's obviously somebody who's 65 and not working, their income stream is far smaller than a 25-year-old who's working. But the wealth of the elderly is not measured in terms of income stream. They've got savings, they've got real estate, they've got a family, they've got people supporting them, they've got grandchildren. They've got all kinds of wealth there that wasn't spoken of, right? So it was a misrepresentation on every level, The initial process, the introduction of the Medicare Act, the initial process, this was resisted very vehemently by the American Medical Association. They could not get doctors on board with this whole process. Once they managed to ram the bill through, however, they decided we need to get these people on board, obviously. So the way that the process worked at its introduction was, if you as a physician or a hospital took care of somebody who was Medicare eligible, this would generate a bill. The bill would get sent to the Medicare agency. The Medicare agency would cut you a check, no questions asked, paid in full. So I do a hernia repair on grandmom. I send him a bill for $1,000, comes back paid in full. Wow, that's easy. Yeah, hernia repair, $1,200. $1,200. Hernia repair, $1,500. $1,500. This goes on for years, buried in the budget cycle. Nobody knows how much money is going out the door to Medicare because there's all this money around at the time. This was in the late 60s. We were living at a time when there was this absolute wealth in the Treasury. Why? Because President Kennedy, probably the last fiscally sane Democrat ever to occupy the White House, had seen what happened in Austria. He saw what Konrad Adenauer, the president of Austria, did to the economy of Austria by reducing the marginal tax rate. Adenauer, who was a very bright man, saw that if we reduce the marginal tax rate, business will improve and we'll actually have more revenue. And Kennedy saw the miracle of Austria, which was the economic engine of free Europe, and he said, hey, this works for us too. And they got a tax cut through the marginal tax rate. Now there's all this money available for things like the space program or things like Medicare. And there's so much money around that nobody's really asking any questions. Now you can't fund the space program anymore or Medicare because we forgot that basic lesson about what marginal tax rates do to revenue. Anyway, so they hit it, but they got the AMA on board. The AMA just became oh, this is such a wonderful thing that we've done for the charitable care of the poor and the elderly. And, you know, as you build your third mansion on the money you're making as a hospital or as a physician. Okay, the problem is that those generous payments by Medicare completely skewed the market. Now you don't really have a sense for what services are worth because the value of the service has been skewed by this liberal payment of money, right? And the fact is, because it's emphasizing the care of the elderly in that whole process, right, Medicare eligible people, you've got young, low-income families paying for the care of middle-class retirees. Is there injustice in this? Huge injustice in that. Okay. The rising prices, though, that are caused by this Medicare payments plan is driving normal people into the arms of private insurance companies. Okay. Before the 1960s, private health insurance was really a boutique market. And it was primarily aimed at executives, people in industry, whose incomes were being capped by an intrusive federal government. Okay, does this sound familiar? Federal government stepping in and capping income in certain key industries. So those industries decide, all right, well, we'll get the benefit to our executives a different way. We'll give them a health insurance policy so they're not going out of pocket for medical care, right? That was about all that was going on until Medicare came along. And now people are being driven into the arms of health insurance agencies because you can't afford to go get that care anymore because the market valuation of the services has been ruined by Medicare, all right? And it's all based on this fear of this fictitious fear of a catastrophe for the elderly. It's a fiction. It was a complete fiction. All right. What it ultimately comes down to is you got to discuss those huge bills. You got to ask yourself, all right, what's the reality here? I went online a couple of months ago and I found this fellow had posted the billing for a recent admission to the hospital. This poor guy, a young single man working for some tech industry somewhere, gets right upper quadrant pain and he's got to go to the hospital. And he goes to the ER assesses him, does some lab work, says we think you got gallstones. They get the ultrasound, a couple other studies. They consult the surgeon comes down, he agrees. Off they go to the operating room, endoscopic surgery, gallbladder removed in about 30 minutes. He overnights it in the hospital, goes home the next day. Miracle of medical care, the endoscopic cholecystectomy. Awesome operation. I mean, the guy's back to work within 3 days of having his gallbladder removed. However, this is his bill, itemized for you, $77,400.